Okay, it's fine. It's fine. Okay, so what we're gonna do now is body composition, right? So we're gonna do an introduction to body composition, understanding what it is, and then different methods of body composition that we use to assess someone's body composition, right? So introduction, body composition is known as the percentage of body weight made up of fat mass versus fat-free mass. So when we look at this stuff, that's how we just differentiate it. So fat-free mass includes bone, water, muscle, connective tissue, organs, and teeth. And then fat mass is composed of essential and non-essential fat, or basically, one way to think about it is fat-free mass is just everything that isn't fat mass in your body, yeah? Where essential fat is part of organs and necessary for normal functioning, and then non-essential fat is stored adipose tissue, right? Recommended body fat percentages. So when we talk about male versus female, there's obviously a big difference between men and female, and something physiologically that men can't do, which is give birth. So women are naturally going to have a higher body fat percentage than men because of this, right? So women's normal situations, and this is always going to be dependent on everybody's specific situation. If we're talking about like if someone's in sport, then we have to look at specific numbers for that sport and what that could be. And then if it's sedentary, then what that could be. Or if it's bodybuilding, what that could be. You know, it's always going to be variable on what normal is or what good is. But a recommended general understanding is that for women, 16 to 25% body fat is pretty good. And then for men, anything less than 20% is also pretty good, considered normal. Extremely low levels are considered borderline unhealthy. Some are unhealthy. And for men, we're talking like less than 3%. And for women, we're talking somewhere between like the 10 and 13 or anything less than that. When we talk about like bodybuilders, for example, when they go into show, they're probably going to be flirting around those ranges. And so is why they don't stay there for long periods of time. It's impossible to sustain that for a long time. Like you have a specific camp prepared to meet that for like a day or like a few days, right? It's not sustainable and it's not healthy. Now the methods for measuring body composition, we have 4 different methods that we typically utilize. There's a few different ones that have been made too that have similar concepts. I'm talking like bod pods and things like that. Those use like volume displacement. So there's ways to go about using those. They're just, done less than some of the more popular methods, right? The most popular probably being a Skinfold calipers, right? So this is an estimate percentage of body fat by measuring subcutaneous fat, right? So with subcutaneous fat on the skin. We have different sites that we use for that are standardized. Some different formulas that have been made. There's like 12 site measures, 5 site measures, 7 site measures. There's like even more than that, I think sometimes. And there's up to like even just 3 site measures, right? Where probably the more information we give it, the more accurate it'll be in some sense. The next method would be the biometrical impedance analysis. This would probably be the more popular setting if you went to like a higher end commercial gym, or most research settings will probably do this. It's very easy to conduct and it's easily standardizable. Accessible is a question because there's different forms of biometrical impedance analysis, right? So if you have like those scales at home that are on the floor and it tells you your body fat percentage and all that stuff, those are technically BIAs as well, but probably not as accurate depending on, the kind of sensors it uses or what's going on with it actually. But those are methods of biometrical impedance analysis that you're probably familiar with, right? If you've ever done like in-bodies or use like a Seika or use one of those machines that you go up to and it tells you to put your hands out like this, right? Those are also BIAs. And we'll get into exactly what it does, how it measures, and all that stuff. The next way would be from a dual X-ray absorptiometry, which is the DEXA, which some of you may have probably heard of. This is going to be our gold standard now and day. This measures everything from bone density and body composition, but we don't use it in this lab because it's expensive. We do have one at the med campus that we use for some research within like the Miami project for spinal cords and all that stuff. Like I've done a DEXA over there when I was a control subject for one of the studies, and it's pretty cool. They basically lie you down on this like X-ray looking machine, and your legs are like strapped together and your arms are strapped to your sides so you don't move. And it's just like a scan that goes all the way up and all the way down.
How long does it take?
Like 5 minutes. It's like 2 minutes. Well, you can't move. That's why some MRIs don't come out good. I've done MRIs, and it's the thing is like you lie in an MRI and it's so stressful because you're in this tube and I moved a lot. They kept telling me to not move. There was this like weird like speakerphone that was in there. Yeah, and they were like, stop moving. I was like, I can't. But the DEXA, I don't know if it's like standard practice. Like I've only done it once, but they like strapped my legs together and strapped my hands to my side. And I was just like, oh. Well, I wasn't moving. It worked, I guess. But anyways, moving on. Then we get into hydrodensitometry, which is underwater weighing, which we will be doing next week, which is where we measure body density through water displacement, right? So we indirectly measure body fat by getting body density first, right? So after the fact, when we have the body density measure, we use it in an equation and we're able to get body fat from that. Yes?
Isn't there one of these in the orbit side?
There's a SECA, the SECA in the orbit side, which is the one that we have here also. It's a biometrical impedance analysis. Were you talking about something else?
No, I think it's the same. It was like we took our shoes off.
Yes, right. So you got, it was the SECA, right? It's the same one we have here, which we'll do today, right? Moving on, body composition standards. Again, just an understanding, which we went into already like previously, but having some understanding of some age-related standards for body fat, and then some for male and female, right? So very lean, excellent, good, fair, poor, very poor, and what that looks like. Yeah, these are some 2018 standards. These change over time. Sometimes they get more aggressive as time goes on, because as time goes on, for whatever reason, the world gets more unhealthy. And so we have to kind of make people feel bad so that they start doing stuff. That's the whole reason why, like, for example, blood pressure. In other countries, there is no such thing as like hypertensive stage 1, hypertensive stage 2, or pre-hypertensive, right? There's kind of just like normal and then hypertension. We just made more like classifications to preemptively start getting people to think about their health. Like, hey, like you're almost in really bad shape. And that's why they do that. But you'll see in other countries, like in Europe, for example, with like hypertension, like it's just normal and then hypertension. There is no like pre-hypertension. They might have like stage 1, stage 2 situation, but like pre-hypertension doesn't exist over there. It does here because, again, we're trying to preemptively get people to start making conscious decisions about their health. So we get into the Skinfold technique, right? The principle is it assumes subcutaneous fat is proportional to total body fat based on body size and different things like that. The accuracy is anywhere between plus or minus 3.4 to 3.9%, but this is going to be heavily limited by, what do you think? Not Abby. I guess it helps to have seen it, but I'll ask you the question again after we do it, and then you'll tell me what you think the biggest limitation is. So we'll be doing the 7-site measure where we go abdominal, triceps, chest, pectoral, mid-axillary, subscapular, suprailiac, and the thigh. And then you'll have an understanding of whether these are vertical folds, horizontal folds, and how we actually take those measures as well, right? Don't worry about the procedures right now. I'll show you how to do those, but that's how they're there. As for the sites and procedures, again, in your lab manuals, you have a better visual representation of like the different sites and what it looks like and how to get the folds and these kinds of things. So I'd prefer you to use that than reading these. But like they're all here anyways, right? So the biggest difference for, again, I guess we'll get into it when we actually do it, and I'll explain it a little more there, right? But again, 7 sites and a little bit different for each male and female. Calculating body density using the Skinfolds, right? So again, now after we have the different measures for each, we would get the sums of those numbers and then implement it into this formula where we get body density based on whether we use the 7-site formula or the 3-site formula. And then with that, we're able to calculate for body fat afterwards, right? So for men, we would use these equations. For women, these equations. And then after the fact, we would put it into another equation after we have body density to where we're able to get body fat. Cool. Now we get into biometrical impedance analysis, right? Again, BIAs are probably going to be the most common thing you see in research settings, just because it's very easy to do, and it gives us a pretty good understanding of where they're actually at with a low room for error, right? There always is going to be room for error based on natural limitations of how things work and how the machines work in general, but we get pretty close without having to do a lot, and it's not it's very non-invasive to the subject versus, for example, if we were to do an underwater weighing, which, yeah, sure, it might be more accurate, but we have to dunk somebody underwater and basically drown them for like 6 seconds. You guys are all gonna do that. Yeah. Right, so the principle of BIA is that electrical current flows through tissue, and that fat has a high resistance to this electrical current due to low water content, and that muscle would not because it has more water content, being that it's more dense, right? So whatever electrodes that we're holding on to, some of them are going to be dual electrodes, some of them are only going to be foot pads, some of them are going to be up to 8 electrodes, right? So like 1, 2, 3, 4, 5, 6, 7, 8. And then each of those is going to send an electrical current through your body, and we're looking at the resistance of tissue as it goes from one to the other, right? And there's going to be like a time component to it of some sense. So the speed at which it goes to the other one and how much resistance there is in between. And that is going to give us an understanding of some sort of overall estimation of how much body fat, how much dense tissue is within the person's body, and thus able to give us our outcome measures. So the key variables of this being resistance, height, weight, age, and gender, right? So typically we're going to put all these things in it and give the machine or some sort of tool an understanding of what is it analyzing. Make sense? Okay. Some pre-resting conditions and procedures that we have to keep into account, because we want to understand that the limitations of this are going to be consistent across populations, and we want to control for these limitations as best we can so that we can get an accurate result, or as close to an accurate result as possible, right? So we want to make sure the person is rested and in a well-hydrated state. When I say well-hydrated, I just mean like not dehydrated, but not flooded with water, right? Because both of those things are going to affect the results of this test, right? Somebody being overhydrated would probably have what kind of result? Would it overestimate or underestimate skeletal muscle?
Underestimate.
Is it underestimate?
More water, it's gonna go through faster.
It's gonna go through faster. So it's gonna assume that the person has less body fat and more muscle, right? So if you want to cheat some of these tests, just chug like a gallon of water before. And if you don't, then just don't drink any water, right? But that's kind of the understanding with that. Make sense? So if you have more water in your system, like you can technically cheat these tests. So these are the limitations that we want to try and control for. So we typically tell the person to come in a normal, rested, like hydrated state, yeah? And then some of the tools that we use, again, we have the Omron, which you'll see in a lot of like gym settings because it's cheap relative to what the tool actually is. I say like $250, but for like a commercial gym, like I guess that's fine. You'll see that it's somewhat interesting in terms of the results it gives you compared to some of the other tools. We have like the Tanita scale, which is something similar to some of you might have done if you have like those scales at home. We have the InBody over there, which is another popular method, and we have the Seika that we use for our research here. Fat-free weight, again, just some understanding of like how to get our fat-free mass, which probably makes sense. We go 1 minus the percent body fat, and then everything else is going to be our fat-free weight. And then ideal is understanding where our preferred body fat is. So if you have an understanding of that, or where you want to be in terms of like if you're prepping for competition, or if you have a specific sport, or if you have some sort of idea in mind of where you want to be, then understanding that and how to get to the ideal situation. Yep. Fat distribution and health risks. We have an understanding that central obesity is highly associated with increased cardiovascular and diabetes risk. This is pretty much already well known within the literature. And some common measurements that we use for these populations is like, for example, waist circumference, where a higher risk if, you know, it's greater than 40 inches for men in terms of waist circumference, or 35 inches for women, right? And then we also have different waist to hip ratios, where there's an increased risk if this is above 0.95 or above 0.8 for women. Yeah, we'll do these as well. That's where we're using like the blue thing and going around. We'll do this also for the Seika, so you have an understanding of that. Other common measurements, we have different waist to height ratios, and then sagittal abdominal diameter, right? So this is more accurate for visceral fat and cardiometabolic tissue, so we would go around and then go through, right? So come here and then in. Yep, I think it's here actually. We don't use this too much here. We kind of use it just for teaching purposes, but outside of that, you probably won't use one of these. It's interesting, but just teaching purpose. And then we get into BMI, right? So BMI is body mass index. This is a very popular method of, understanding or classifying someone within some sort of body composition theory, right? You'll see this a lot used at like different doctor settings or clinics and things like that, just because it's a very easy method to get. And a lot of times they won't understand anything outside of this, just because this is what's primarily taught in like medical field, right? So whenever you go to a doctor, very rarely will you do like a body composition assessment. You'll probably just give them your height and weight, and they'll give you a BMI, and we'll explain the limitations of this itself, but this is also like when we have understandings of like average within a population. A lot of times people get those like survey phone calls, and then they'll get asked questions like, oh, like how tall are you? How much do you weigh? And then with that, they're able to calculate for BMI and then have an understanding of like being able to implement this into the research. All right. BMI is a very easy number to get. It is you really need to know who you're working with, what you're looking at, and why you're asking for this. It's a good number for sedentary general population. Outside of that, it's probably useless. Yeah? And again, understanding that this does not directly measure body fat, and that two individuals can have the same BMI, but entirely different body compositions, right? You can have a bodybuilder who is extremely lean and has a ton of muscle on him, but he's a short king. And you can have a really, a bigger person. And they'll have the exact same BMI. And then the doctor will tell you, oh, like, you're obese. And it's like, they're looking at him and he's got the six pack through the moon and he's just a short king, So BMI it's an interesting number. So you just have to take into account what it is you're looking at and how you're looking for it and who you're working with, right? So some health implications of fat distribution. Central fat distribution is linked to an increased risk of cardiovascular disease. Again, we know this, and different metabolic disorders. Measuring central fat using waist circumference, waist to hip ratios, and waist to height ratios can provide better insights into health risks in BMI alone. Another thing that we didn't really get into, but an important thing to understand, is a lot of times if you are working in commercial settings or gym environments or different things, a lot of times you will be working with obese populations, right? And so we have to understand that there is somewhat of a psychological component with this population as well. When these individuals come to train, they are already in a very stressed environment and in a situation where they're extremely uncomfortable with the environment they're putting themselves in, right? Obviously, as exercise professionals or physiologists or coaches, whatever the things we do, we have the goal of helping them get from one point to another, and obviously from point A to a better point B. Now, when I go back to like the psychological component in body composition assessments, they know that, they're obese. They know this. It's probably not a good thing to give them a number that repeats that to them, right? Again, different psychological components. We want these people to have the want to come back, right? Not to be kind of told over and over and over. There are psychological components to this that we do have to take into account. So it's probably not in your best interest to do like a Skinfold assessment on an obese person, for example, right? Don't pinch. It's not nice. The other thing is the same thing with like, BIAs and different things like that. Like it'll give you a number, it might just affect their head a lot more, right? So there's other things that we can do that are still positively influencing, that have a little bit better results for them, right? Different things, for example, being like these waist to hip ratios, waist to height ratios, and all these kinds of things. But maybe you guys know, what are some other things that we can do with them? Not Abby, I'm pretty sure you know this, but. I guess it's kind of hard if you haven't been taught it. But the other things that we can do are like girth measurements, right? So if we go based off different sites that we know of, for example, like neck, biceps, like thighs, different sites that we can like measure over time. These are typically going to be a bunch of better ways of helping someone understand like, hey, you are improving without affecting their psychological state, if that makes sense. I think it's much better to tell someone like, hey, like your, you know, bicep girth went from 40 inches to 35 inches. Like that's great. Versus telling someone, hey, you went from 42% body fat to 40. Like, no, you know, or whatever the case may be, you know. This is really only for those kinds of populations when we're working with like obese individuals or like very overweight individuals where there is like a psychological component that we should take into account and respect. Yeah? Any questions on anything body comp related? This is a big topic. This is going to be one of the bigger topics of the course. So if you do have any questions, you can ask. Cool. Next week, we'll get into underwater weighing and understanding that. That'll be the whole class. You'll get some cool stuff there. And yeah.